Okay. Today we'll talk about the support of the uterus from J.V. Sharma. The connective tissue supports of genital tract. The connective tissue which is attached lateral to the uterus and cervix is called the connective tissue. Those are attached lateral to the uterus and the cervix is called as parametrium. These are the connective tissue. These are the connective tissue. Those which attach lateral to the uterus and the cervix is called parametrium, which continue down along the vagina at the paracarpium. There is 6 pericervical ligament, that is each to pubocervical, macrotron, transverse, cardinal ligaments, uterosacral ligaments. First one is the pubocervical ligament or fossa, that is originated from back and inferior surface of the superior pubic ramus. White line, that is white line, arcostenius fossa, and insert at anterior and lateral aspect of the supravaginal cervix. It is also called as bladder pillar. Okay, remember the pubocervical ligament, that is pubocervical ligament, that is fossa, that is originating from the back and the inferior surface of the superior pubic ramus and white line of the arcostenius fossa pelvis, that is insert at the anterior and the lateral aspect of the supravaginal cervix. It is also called as a bladder filler. This pubocervical ligament. Then is cardinal ligament, or also called as macrotron ligaments or transverse cervical ligaments. These ligaments are on one on each side. These are the condensation of the visceral peritoneum. That is visceral connective tissue, which provides support to the cervix and the upper vagina. They arises from the lateral supravaginal cervix, the lateral supravaginal cervix, and the upper part of the lateral vaginal wall, and are inserted in the lateral posterior lateral aspect of the pelvic wall near the origin of the infundibulum internal iliac artery. The uterine artery and the vein traverse with them. The ureter also pass through them under the uterine artery. In the uterine tunnel, they have a high tensile strength, provide main support to the uterus. Then the uterosacral ligament, they arise from the posterior lateral surface of the cervix at the level of the internal os and inserted into the periosteum of the S2 S4 vertebrae and of sacrum, or on the to the pelvic side wall, or coccygeosacrospinous ligament, as is suggested by recent MRI study. Coccygeosacrospinous ligaments. They're made of pelvic cellular tissue, smooth muscles with pelvic autonomic nerves within the uterosacral fold of uterosacral ligaments. Pubic symphysis, this is pubocervical ligaments, there is pubocervical ligament, this is bladder, vesicovaginal fossa, macrotrods, transverse ligaments, that is cervix, rectovaginal fossa. This is the rectum, uterosacral ligaments, there is rectums, that is uterosacral ligament, macrotrod ligaments with line of the arcostenius fossa pelvis. Then uterine support, the main support of the uterus and cervix is provided by the interaction. The main support of the uterus and the cervix is provided by the interaction between the levator and muscle and the connective tissue attaching the cervix to the pelvic wall through the parametrium and paracarpium. Hence the cardinal and uterosacral ligaments, the main support of the uterus, levator and muscles also. Vagina also provides support to the uterus. Hence the uterus is supported by pelvic floor, pelvic cellular tissue, fossa ligaments, vagina, pelvis. The support of the cervix and upper vaginal support. Delancey classified cadaveric dissection described 3 levels of supports. The vaginal connective tissue supports, whose dysfunction manifests as various types of prolapse. The cervical and upper vaginal support, that is level 1 support. There is a level 1 Delancey. The cervical and the proximal vaginal support is provided by the ligament of the parametrium and paracarpium, which are mainly cardinal and macrotron uterosacral ligament. The level 1 support is also called the suspensory axis. The fibers are vertically oriented on the standing position. The damage of level 1 support led to enteroceles and post-hysterectomy, vaginal wall prolapse, and the enterocele formations and the cervical prolapse. The mid vaginal support, the level 2, the mid vaginal attachment, the refer to level 2 support attachment of the axis are the attachment of the visceral connective tissue endopelvic fossa from the lateral vaginal wall to the arcostenius fossa of the pelvis. That condenses of the fossa internus to the medial aspect of the levator and muscles, where their attachment anterior and posterior lateral vaginal sulci recreated, giving a H shape to the vaginal cross section. The attachment of anterior vaginal wall to the levator and muscles responsible for bladder neck elevation observed during the work of Valsalva maneuver. The damage to level 2 support lead to anterior and posterior vaginal prolapse, trace urinary incontinency. The distal vaginal support, the fusion axis, that level 3, the distal third of vagina is attached directly to the surrounding structures. It is attached and fused anteriorly to the urethra and laterally to the pubovaginal muscles, perineal membranes, posterior to the Perineal body, they are supposed to strongest vaginal support system. Damage to level 3 support cause distal erectocele, perineal descent, and anal incontinence. The round ligaments, these are the pair of cord-like structures, fibromuscular structure, which is 10 centimeter long and attached to the lateral aspect of the uterus. Corpus, lateral aspect of the corpus, cornu of the uterus, just below the anterior, just below and anterior to the origin of the fallopian tube on either side. They contain the submuscle cell, connective tissue, are homologous to the gubernaculum of testis. They extend laterally to the pelvic side wall, behind the anterior leaf of broad ligaments. Behind the anterior leaf of broad ligament to enter the inguinal canal through the superficial internal ring. They come to out of the inguinal canal by the external inguinal ring to merge with the subcutaneous tissue of the labia majora. Blood supply, they are supplied by the substance artery, which is a small branch of the uterine aberrant artery. The lymphatics from the uterine corpus, the lymphatic of the uterine corpus pass along with the round ligament to drain with the superficial inguinal lymph nodes. The function of the round ligament is act as a gyros, the fundus of uterus, by acting with uterosacral ligament. Along with uterosacral may have some role in keeping the uterus antibudded and antiplex, but they are shortening by surgical procedure. They are doing shortening procedure to use to antibud the uterus. However, the current thinking that there is don't significantly contribute the uterine support. They are importantly landmark of the gynecological surgeon while doing sterilization operation. So these are the important landmark to do the gynecological surgery while doing sterilization operation through mini laparotomy. Incision as the fallopian tube lies posterior to them. The division of round ligament is also the first step in the abdominal hysterectomy, laparoscopic hysterectomy, as it's open the broad ligaments for further surgery to identify the uterine and uterosacral ureter for safe surgery. The ovarian ligaments, they are the 2.5 cm long pair of fibromuscular cord which runs from the cornu of the uterus and behind the fallopian tubes to the medial border of the ovary. Through the posterior leaf of the broad ligaments together with round ligaments, and they are from the homologous to the gubernaculum testis, the male. The broad ligament, there is the double layer of peritoneal fold that extend from the lateral wall of the uterus to the pelvic wall. They are pair on each one in each side with the anterior and posterior leaf layer being continuous at upper free border of the containing the fallopian tube, ovary, and round ligaments. The lower portion called the base of the broad ligaments, the contain the cardinal mechanoidal ligament. The anterior fold of the peritoneum reflect uterovesical. Anterior fold is uterovesical post, posterior is from the pouch of Douglas, longer covering the upper third of the posterior vaginal wall, being reflecting from the pouch of Douglas. The part of broad ligaments, there will be mesoovarium, mesosalpinx, and the mesometrium, and the mesoovarium, mesosalpinx, mesometrium, and the infundibular pelvic ligament or suspensory ligament of the ovary. It is the mesentery. The mesoovarium, it is the mesentery of the ovary. The mesentery ovary that made by fold of peritoneum which connect the uterus ovary to the posterior layer of the broad ligaments. Ovarian blood vessels, lymphatics, and nerves are the carried to the ovary through it. The mesosalpinx is the mesentery of the fallopian tube that lies, which is the part of broad ligament. The mesentery of the fallopian tube, that is the part of the broad ligaments which lies between the ovary and the fallopian tube, between the fallopian tube and the ovary. Uterovarian anastomosis, vessels, and embryonic ligament are contained in it. The mesometrium is the longest part of the broad ligament. It lies below ligament which lies below the mesosalpinx and lateral to the uterus. The infundibular pelvic ligament, the ovary, and the infundibulum fallopian tubes are attached to the lateral pelvic wall. Infundibular pelvic ligaments. It extends extension of broad ligament from ovary to the lateral pelvic wall, carries ovarian artery, nerves, lymphatics, lymph nodes from the ovary and fallopian tube. This ligament is clamped, caught, transfixed during the salpingo-uterine operation in ovary. Then the content of the broad ligaments, there are fallopian tube, uterine and ovarian arteries, and there are anastomosis vessels, nerves, and lymphatic from the ovarian and uterine tubes, and the uterus, ovarian ligament, peritoneal proximal part of the round ligament, parametrium, its fat, loose connective tissue, embryonic remnants of mesosalpinx like gatinodoc, ibupuron, and parapuron. Gatinodoc is the remnant of the meso-Ulpian ducts and run parallel to the fallopian tubes up to the upper uterus, then runs down along the side of the uterus at the level of the internal os. It descends in the wall of the cervix, then through lateral vaginal wall into the hymens. The ibupurans, they are remnants of proximal tubules of the mesonephrons, which are 8 to 12 vertical tube with their blind end towards the ovarian hilum, while the other broad ligament cyst. Parapuron. These are the few stage tubes. Remnant distal tube, major broad ligament. Applied end broad ligaments with the loose remnant the uterus position. They don't provide any different support to the uterus of the broad ligament has to be opened during hysterectomy operation.